Hello. Welcome to Navigating the Skies of Air Medical Billing. Just as pilots navigate the skies, the aim here is to traverse the intricacies of air medical billing. This session is designed to shed light on the complex layers of billing within this industry, while prioritizing clarity and comprehensive knowledge. We'll explore essential information tailored for healthcare professionals, patients, and the broader community. Similar to various areas of the healthcare system, air ambulance providers bill using Healthcare Common Procedure Coding System, or HCPCS service codes for short. Specifically, there are 2 service codes for rotor wing and another 2 for fixed wing. Each has its own base charge, with rotor wing and fixed wing having distinct rates. Additionally, a loaded mileage fee is calculated based on the statute miles transported. Beyond these billing codes, insurance affiliations play a key role. Many air medical providers have in-network affiliations with major insurance companies. This means they have agreements with these insurers, potentially offering lower rates and streamlined billing for insured patients. While this No Surprises Act overview goes into some intricate details, it's crucial to grasp the nuances, as they play a pivotal role in understanding the full implications and patient protections provided by the legislation. Now let's delve into a brief history of the No Surprises Act. Before the NSA, patients often received unexpectedly high bills for air ambulance services. These surprise bills happened because the air ambulance service might not have been in the patient's insurance network. While many states attempted to regulate air ambulance billing, they were restricted by the Airline Deregulation Act of 1978, which limited states' ability to control air carrier prices, routes, or services. The No Surprises Act is a federal act passed by the United States Congress, and the act went into effect on January 1, 2022. The No Surprises Act aimed to protect patients from unexpected medical bills related to emergency care, certain out-of-network services, and air ambulance transports provided by out-of-network providers. With the introduction of the No Surprises Act, claims are categorized into 2 primary groups: those within in-network agreements and those considered out-of-network. In-network agreements specify mutually accepted reimbursement rates. Consequently, providers cannot bill patients for any additional amounts beyond copays and deductibles, no more surprises or balance bills, ensuring patients benefit from these negotiated rates. For out-of-network claims where providers and payers don't agree on the reimbursement total, the NSA introduces the Independent Dispute Resolution (IDR) process. Independent Dispute Resolution engages a neutral third party for arbitration, assessing submissions from both sides to finalize the reimbursement rate. Also ensures that patients are only held accountable for payments aligned with their plan's stipulated copays and deductibles. In essence, healthcare providers and insurers are now required to work out payment disputes amongst themselves without involving the patient, thus ensuring the patient is kept out of the fray of larger systemic billing issues. The Act also requires providers to give patients a price estimate for services upon scheduling non-emergency care, such as a prearranged air medical transport. Non-compliance with the No Surprises Act can lead to significant penalties for providers. This not only ensures that patients' rights and financial well-being are prioritized, but also shields them from exploitative billing practices. In summary, the No Surprises Act, instituted in 2022, underscores Congress's dedication to shielding patients from unexpected medical bills, especially in areas such as emergency services, air ambulance, and out-of-network encounters. The Act removes patients from the often complex billing conflicts that arise between providers and commercial payers. It establishes clear distinctions between in-network and out-of-network billing and introduces the Independent Dispute Resolution process. Also, the term, holding patients harmless, is a key provision. Patients are only responsible for their in-network cost-sharing amounts, even if they receive out-of-network emergency care. The Act also mandates transparent pricing for non-emergent services. And finally, there are significant penalties for providers and healthcare facilities that do not comply with the NSA provisions. Government payers. Medicare and Medicaid have specific published fee schedules that dictate reimbursement amounts to providers. These rates are set irrespective of the billed charges. Most companies, as a proactive measure, choose to be a participating provider, which means they accept the government-mandated reimbursement rates upfront. For those under Medicare, patients have a financial responsibility, a 20% copay of the Medicare allowable for services. Importantly, a large portion of Medicare patients have supplemental insurance. This insurance typically covers the 20% copay. For Medicaid enrollees, the scenario is different. They are not required to pay out-of-pocket expenses. This ensures their medical services are provided without immediate financial barriers. Also, it's worth noting that Medicaid, being a collaboration between state and federal entities, may have variations in coverage across states. A foundational rule with both Medicare and Medicaid is the prohibition of balance billing. This means patients cannot be billed for the difference between the provider's billed charges and the rates allowable by Medicare and Medicaid. Other coverage options include the Veterans Health Administration (VHA), TRICARE for active military personnel, workers' compensation, and auto liability. Each of these entities offers distinct reimbursement policies which can be inconsistent and often lack publicly available fee schedules. When dealing with individuals who are not covered by insurance, Medicare, Medicaid, or any other specific programs, they are categorized as self-pay or privately paid clients. This implies that they are individually responsible for settling their medical bills. However, most organizations acknowledge the financial challenges that can arise from this situation. To address these challenges, companies often assess the financial capacity of such clients. Usually, the aim is to establish reasonable payment plans that align with their specific financial circumstances. Typically, in cases where clients are unable to meet their financial obligations, any outstanding amounts are often written off as non-recoverable debt. With a profound respect for our unwavering dedication to patient care and a keen awareness of the complexities of billing practices, we recognize the challenge of ensuring operational sustainability. As we navigate the intricacies of air medical billing together, let's stride into the future. Fueled by passion and guided by integrity, let's pave the way for a brighter, more transparent horizon for air medical services. Thank you, and be safe.